Well, hello and welcome to Everyone's a Storyteller. I'm Dr. Daintee Jones, and I serve as Director of Fund Development for the Ensemble Theater. This channel is a support channel for the Young Performers program at the Ensemble Theater, where we have youth from the ages of 6 to 17 who study theater arts. The purpose of this channel is to show them that even though they are studying the arts here at the theater, that arts, the skills they learn are transferable ones. So the power of storytelling is quite magical indeed. And so we are interviewing different leaders here in Houston, Texas, to share how they tell stories. So today we have Dr. Archana Kumar. And welcome, Dr. Kumar. Welcome.
Thank you very
Mhm.
much. It's a pleasure to be here.
It is wonderful to have you. Will you share your title with us, please?
Yes. My name is Archana Kumar, Dr. Archana Kumar. I am a professor of biology at San Jacinto College, Generation Park.
That is wonderful. And that is how I met you. I'm honored to have met you there.
That is true,
And
very true.
yes. And will you tell us a little bit about your present position?
Yes, so I am currently the lead. So I handle anatomy and physiology, so human body classes at Generation Park. And the goal of these classes are to teach the intricacy of the human body. So what do the organs do? How do they work? How do they function? What are the components of these organs? For example, how does our heart pump blood? How do we use the restroom? How do we eat that slice of pizza? And our food and our body digests it and absorb all that nutrients. So that's really the core of the class, is to teach students the intricacy of how the human body works in everyday life.
So, and on your in your daily walk, what kind of storytelling is helpful? Is it inspirational? Is it encouraging or logical? How would you describe the type of storytelling you use on your position?
So because I teach the human body, my storytelling is a little bit more logical. I always like to tie it back into the concepts that I'm teaching my students, whether it's bones, it's the heart, it's the kidney or kidneys. And I think that when I do talk about stories, my personal experiences or my personal stories with my students, it catches their attention. It makes them feel a little bit more comfortable in terms of one, being in the classroom, right? And two, it also changes the pace of how I'm delivering my material. So rather than me standing up there and lecturing my student, which is generally how a science class is, it storytelling actually provides a break in the lecture, and it allows the students to interact with each other, to laugh, to share their own personal stories. And there are also times where I have students who generally are a little bit reserved and they sit back. But when I initiate the storytelling, or I tell them a little bit about my experiences, and then another one of their classmates chimes in, you can see that smile in their face, or they open up a little bit and you can hear a little comment come out from, their voice. And I think it's so important to have that break or have that opportunity in terms of storytelling. And not a lot of individuals think that, oh, because we teach a science class, that we would even incorporate storytelling in our classroom. But it's very beneficial in terms of making the connection between what I'm teaching them and their daily life and what they experience every day. It builds a relationship between me as a professor and the students, and also student to student. Right? It makes the climate of the classroom a little bit more positive. It shows the passion not only for the student but also for me, and it also shows that as professors, we may be put on this pedestal. And students do put professors on this pedestal, but we're also human beings. And giving them that encouragement that, okay, we also experience all of this, and how does it correlate back to what we're talking about in class? It makes them feel a little bit more open and more likely to approach me, approach their fellow students. So having that openness is very important in the classroom through storytelling. And so I do incorporate it every day in my classroom whenever I'm talking about something in terms of the human body.
Oh, that's wonderful. So
Yeah.
I love how you're making the topic relevant for them
Mhm.
through storytelling, how you're making your life relatable to them as well. And then also you spoke about timing. Of the interviews we've done so far, no one has mentioned the power of timing in storytelling. So thank you for sharing that too, because that is something that students are learning when they're on the stage, that so much about what they're doing also involves timing,
Yes.
whether they're waiting to hear their lines, whether someone dropped a line and they can hear the pause and then step in there. So yeah, so thank you. Thank you for speaking about timing.
It's nerve-wracking a little bit when that happens.
It
So
can be. Yes, it can.
yeah,
It can be.
our our brain goes into like this freeze mode. Like, oh my God,
Yeah.
where was I? Where did I leave off? So yeah.
Yes. So awesome. All right, so our next question is, can you give an example of how you've used storytelling to turn a challenging situation into a successful testimonial in your professional or your personal life?
Um, so I think in terms of my position and in terms of the student's position, there is limitation in terms of how much storytelling, personal information I can share with my students, and how my personal information can shape a student's perspective of me, not only as a professor, but as a person. And so when I share my stories, I am a little cautious. I have to be honest about that. But I'm also very open as an open book. Now, in terms of how or what I teach, it doesn't always correlate in terms of my personal life. However, we're all human beings, and I've had some health issues that has popped up over the course of several years. And so again, because I do teach human anatomy, I think, going through some of the health issues that I've experienced is very, I don't want to say it's a good thing, but it's beneficial because I can share my experience to my students and correlate it to my class. So for example, one of the topics that we cover in my course is blood. It's part of anatomy and physiology too. And so the topic that we cover is anemia or sickle cell anemia. And so I suffer from anemia. I'm anemic. And only a couple of years now, I realized, and I've had to go through infusions. And so I did share this with my students because I wanted them to get a better understanding of how blood cells work and the importance of blood circulating through the body, supplying oxygens to the organs, to the tissues, and what can happen if that's not done properly or or adequately. And the organs can shut down and the tissues will struggle, muscles will hurt, the individual will be cold, their fingers, they'll have low blood circulation. And so I did share this personal experience with my students. And to be honest, I was quite surprised on the feedback I got because a lot of my students share their own perspective, and a lot of them also suffering from this particular health issue. And it made my students a little bit closer to me. One of the side effects of being anemic is low blood oxygen, and that could cause an individual to pass out. And so when we were talking about it, I told my students, I was like, if I pass out, don't worry, don't panic. It was just a way to laugh about it, but it was also a way to learn about my students' health and advocating and telling my students that if you think something is wrong or you suspect something is wrong, advocate for yourself, right? These are the symptoms. This is what you may experience. Learn more about how your body functions so that you can advocate outside in the world, because our health system, nowadays, doctors have to see a certain amount of patients. And then after that, they're done. They have a quota to meet. So advocate for yourself. Race plays a role, gender plays a role on how we're treated in a hospital or in a doctor's office. But if you know more about your own body, you can advocate for your health. And that's the story of how I teach my classroom and how I correlated back to the topics that we do in class. I teach my students, advocate for your health. If you think this is something's wrong with you, push your doctor, do more tests, advocate for something that needs to be done. And so it made them open up more. And then after that they started expressing a lot of their health issue. And I was like, you have to see your doctor. It made it more open, and it was a way for me to continue and for them to share with me even more stories. And the stories that I have heard, I mean, Dr. Jones, it's insane. I mean, the stories are hilarious. But it teaches everyone in the room about how the human body interacts with each other, how these things happen, how structure works, it functions, and it makes us human, right? But also when students shares their story and when I share my story, it helps them remember some of these concepts, which I think is really important, rather than it being a bland, okay, here are your lines, here is your sentences, here are your definitions, right? You're not just meant to memorize and then just say it, but if you correlate it to a story, it will help the student understand, and it will make the student more comfortable learning about that. And I think that's very, very, very important. It's not just about recalling information through memorization, but it's about recalling information through experiences and through stories. Okay? And students can actually take the concepts that they learn and the data and the facts, and they can tie them together through these stories, right? They can trace it back and say, oh, I was in the class, I remember my professor suffers from, anemia, or my classmates said the same thing. These are the symptoms. These are the effects that it can have on the organs. And so I think it's very important as professors that we do share our stories. I do think there is a boundary, there is a fine line, but as long as the instructor or the professor is comfortable and it's a safe place, then I think it's okay to share these storytelling experiences and relating it back to what they're learning, the foundation of what they're learning.
Oh, yes, that's excellent. And even in your convincing them to be advocates, that's still storytelling, right?
Yes.
They are having to learn to communicate their
Mm-hmm.
health-based story. And then
Yes.
you spoke of sort of experience-based learning so that
Mm-hmm.
they're going deeper into the learning process. So thank
Yes.
you for doing that for the students. Thank you.
It's important for them to transition, and not just sit there and say, okay, this is what I have to learn, but how does it relate to my everyday life?
Yeah.
It's so funny. I tell my students when we talk about the digestive system, they get a little grossed out. But I'm like, you should be checking yourself. And, every time you use the restroom, you should be looking. I know it sounds crazy, but it's telling you a lot about your health, right? And this goes back to like the urinary system and the digestive system. And they're just surprised that, some of them don't do it. But then, the next day they come back, they're like, Professor, I did what you told me. And I think the other thing is, we know that a lot of health issues are arising in younger generation across the board, regardless of religion, regardless of race, everything. Cancer's on the rise, especially for younger generation. And bringing self-awareness to us, because we're not always in a clinic, right? So expressing my stories on how I do things on a daily basis to check my health is very important, that we share this information with younger generation, because sometimes our doctors or won't tell us, or sometimes even our parents won't tell us, you know and so I think it's a learning experience even for the students in my classes. They're adults, some of them, the age ranges, but even the adults are a little bit taken aback and said, you know what, I really do need to start doing this, because I'm learning a lot about the human body and how I can pick up things before it's too late. It's good to examine yourself, make sure everything is okay. And I think that's very important when we talk about storytelling, especially in my classes, and relating it back to the human body. So there needs to be some sort of correlation between the two. And teaching them is very important, but the story should have something that convinces a student to go back home and say, you know what? I need to do this. I can do this. I can relate it back to my system. I can pass my exams. All of that is important, right? But experiencing life through storytelling is very, very important.
Yes, it is. Awesome,
Mm-hmm.
awesome. Now, the next question you've already talked about a little bit, but I'll ask you anyway, just in case you'd like to add to
Yeah.
it. And this question is, what techniques do you use to ensure the stories that you tell resonate with your target audience?
Yeah. So one, obviously sharing my own personal experiences, my personal health issues, and my personal craziness. Um, but you know, I also use case studies a little bit. This is a little bit off to the side, but I do case studies where I create stories, paragraphs, and I tell my students, or I teach my students how to assess a patient and then how to correlate it back to what they're learning, which is a storytelling. We just call it case studies, essentially.
Mhm.
In your definition, it's called storytelling. In ours, it's called case studies or clinical scenarios.
Yeah,
And these clinical scenarios is basically a story where I give my students and I give them the patient's name, the age, their symptoms, their health history, what they're coming in for in terms of if they were the doctors, if they were the physician, they would learn how to assess that. And then when they come into class, they would basically form a group and they would explain how they went through the story, their perspective, how would they diagnose a patient, what from the course did they learn and how did it integrate to each other. That's one way that I know that they're learning through storytelling or through case studies, aside from me sharing my information to them and aside from them sharing their information to me. Um, those are just different ways that I do incorporate it, and it's through case studies. And a lot of our science courses now are integrating case studies into the classroom storytelling. And the reason is because a lot of the students are in allied health. And the goal of allied health, whether you want to be a nurse practitioner, whether you want to be a medical assistant, a physical therapist, a surgeon, whatever you want to be, the core is you learning how to interact with a patient. And by doing so, we start off with a story or a case study. And I do know that students struggle a little bit in terms of interpreting a story that they read, but it's a good practice just in case, they go into higher level science classes where this is the core of exams and how the teacher teaches. All stories, all storylines, and assessing the patient through stories. So integrating that into my classroom is one way that I do it aside from sharing my own stories.
but that is wonderful. Thank you for
Yeah.
showing us that case stories are
Mhm.
synonymous with storytelling. And I
Yes.
don't think I'd even thought of that before, even though I've used case studies.
Yes.
I don't even think I thought about it in that way before. So, yeah,
Yeah.
thank you for
Because you're
making that
sharing with the
very plain for
students.
us.
You're sharing
Hmm.
with the students, right? Okay, this is a little bit more about the patient. The patient went through this, their diagnosis. So we're giving them the story of the patient. Now they have to be able to interpret that story and formulate
Yes,
how would you not cure, but how would you treat this patient? So it's just a
yes.
different perspective to storytelling a little bit.
And it's a great life-saving, life-altering way to use
Mm,
stories. That's beautiful.
yes, very. And my students are like, oh, I have that, or I've experienced it. So I can relate to that story, which means it
Yes,
makes it a little bit easier for me to understand what's happening with this patient.
yes.
So that's just a little different storytelling, but it's close to it.
I I love it. I love it, Dr. Kumar. All right, so we're almost there. Here's your next question. What impact have you seen storytelling have on your audience's engagement and their retention of the material?
it it makes a big difference. And like I said, we know science classes are very mundane. They're very straightforward in terms of this is what you need to learn, this is the definition, this is how things function. But in terms of how students are able to express or speak scientifically has improved a lot when we incorporate real life situation, real life storytelling. It is so powerful because it allows them to make that connection between theory and practice, right? And so their brain is able to put that information together through storytelling. They may be able to recall information a little bit easier, right? And so based on what I've seen my students is that they're able to answer difficult questions in terms of when they come into the classroom and I give them something where they have to write an essay and explain a concept in terms of anatomy and physiology. And so they will make the correlation and say, based on the conversation and my understanding of, I'll go back to the whole anemia thing, right? Where blood cells, when there's low of oxygen levels in the blood cell, this can happen. Organs can slow down, tissues will not work the same. So they do bring it back in terms of when they have to explain a scientific reasoning. And that goes also back to the case studies, right? So when students answer those storytelling and they have to tell me a diagnosis, they are telling me that they understand the concepts. They understand how it interacts and goes back to anatomy and physiology and how the body functions. And so if they're able to do that, that tells me that, okay, yes, one, they've learned how to diagnose a patient. And two, they've learned to bridge that gap, bridge the theory to practice. And that's actually my dissertation thesis was, teaching students how to apply theory to practice. Take these storytelling concepts that I have given you and bridge the gap and be able to say, okay, this would happen in the body, because of this. And so they do have an increase in knowledge, and it's not just memorization. It's critical thinking, it's clinical reasoning, it's mapping. So it's making that connection that's very important. It's active learning in all those forms. And it all goes back again to storytelling, right?
Yeah.
And giving them that application of theory and that they remember, oh, I've experienced this. I go through it. I remember the concepts. I can make the connection between the two. So it is helping a lot. And actually the research out there does show that storytelling in terms of the scientific world makes a huge difference where it's not just memorization, but it's critical thinking and it's teamwork and it's quantitative skills and it's qualitative skills that they're learning. And it's learning how to interpret data, all through storytelling. So
all through storytelling. Pretty
So very
amazing.
powerful, very, very powerful
Yes.
tool in terms of learning. And I'm speaking from a science background in terms of human anatomy. And 100% it's storytelling across the board, right? But in terms of where I sit and my position, it's very powerful in shifting students' mindset into critical thinking, which is very important because it is a skill that you will carry on as you progress in college, in grad school, whatever you choose to do, right?
Yeah.
And it's all coming down to storytelling and learning how to reason through that.
Oh, that is wonderful.
Mhm.
I remembered hearing some employers in the Houston area speak, and when they were asked what do they want to see more with our recent graduates who are going into the workforce, critical thinking is one of the things that came up. It was communication, critical thinking, and teamwork.
Yeah.
So thank you for the way that you're preparing the students in your class to be very effective,
Mhm.
not just with their subject matter content, but also with the way that some people call it soft skills, some
Yes.
others call it employability skills. So, yes, we're grateful to you
Mhm.
for the way that you are preparing the
Mhm.
students for success. And I will say, if I ever have to go to the hospital, I'm hoping that my health staff are critical thinkers.
Yes,
They're not just
100%.
theoretical.
That is very true. Very true. I tell my students the same thing. You want to be able to think critically because every
Yes,
situation, every story changes. Every patient is different, which means that if
That's
they're
right.
different, their story is different.
That's right.
And storytelling is such a powerful pedagogical tool that, we have as professors or as instructors, right? It helps foster their learning. And these are skills that they're going to need regardless, like you said, regardless of the position, whether it's allied health, whether it's in the arts, whether it's in technology, it's across the board where it's a powerful tool to have because it will teach them that soft skills that they need. And like I said, bridging theory and practice.
Yes. Bridging theory and
Mm,
practice.
yeah.
That's great. All right. What ethical considerations should one keep in mind when using storytelling in one's career?
So speaking from a professor standpoint, I think it depends from instructor to instructor. I know that students put professors on this sort of like on this pedestal, and I think that sometimes when we maybe disclose too much or overuse personal storytelling, it may breach that barrier between student and professors. And it might make the students feel a little uncomfortable or not willing to talk about, their situation with their instructors. So I think that as professors, we should be wary on how much details of storytelling we should tell about ourselves to our students. And so I think for me, I don't really hold back so much. And the reason is because I teach science. And because I teach science, that is all about the human body. And in the class, we all are adults, and the goal is learning more about the human body, regardless of what that part is. And everyone in that classroom should be comfortable talking about all of the structures and all of the functions. And we talk about everything: skin, heart, reproductive, kidneys. And there should be no, I don't want to say no shyness, and sometimes there is a little bit. Um, but I try to remind my students that in this classroom, we respect each other in terms of what we share. There's no prejudice, and everyone should feel comfortable with sharing how much they're willing to share with their classmate. No one is forced to share any information. I do share, I have a limit to what I share. And that's just to make sure that my students still remember at the end of the day, I am their professor and they are my students. But I give enough where I say it's a comfortable environment. We should all be comfortable with speaking and using anatomical terms. And you know what, Dr. Jones, I think it's okay for students to share. And I have heard a lot of things in my classroom, a lot of stories. And some of them are funny. Some of them deal with reproductives. And I think that's a topic where it's, I don't know if I want to call it a delicate topic, but it's a topic that not a lot of you would not hear outside in a normal day, right? And so topics that are not spoken outside of the classroom on a daily basis is actually students are more freer to talk in my classroom because it is topics that we are covering. And I don't want to say so much about it, but there is boundaries that I do keep. But I tell my students that respect is important, speak freely, no one is looked down upon. And to be honest, all my students share a lot of personal information. And it's not because it's not insulting someone, it's more of curiosity. It's more like, okay, we're talking about this human organ right now in classroom. I have a question that that's not being answered outside of this classroom. And so it's a safe environment so I can ask my professor. And so I think that's important for us as professors, making it a safe haven, a safe place where they should feel comfortable to ask questions. Now, I'm not saying I'm going to disclose that because, again, there is boundaries. But if my students ask a personal question, I will answer it and I will always relate it back to the human system. So there is boundaries, but it should be where the students don't feel uncomfortable. Right? They should not be hesitant to speak. It shouldn't be an inappropriate topic. It shouldn't be an inappropriate storytelling from the student side, and it shouldn't be inappropriate from my side. And so there needs to be boundaries a little bit. But like I said, my topics that I cover in my classroom kind of steps over a little bit of that boundaries. And so these students who are taking my class know that. And it's okay to ask questions. And if I can answer it appropriately, I will. And there are times where I say, you know, I'm not a doctor. I'm going to refer you to your medical advisor, right? And I won't share and say, oh, I've experienced that. No, right? So there is boundaries that I do keep. And I think it's important as professors. But like I said, Dr. Jones, it's important to make my classroom a safe haven, especially the topics that I cover. Because it's very easy for students to feel uncomfortable when we talk about the human body in general. And that is really, really important, that no one takes offense to anything. And so there are boundaries, but it's open as well. Yeah.
Excellent. It looks like you have created a balance.
Yes.
Having a classroom as a safe space is so
Mm-hmm. Yes.
So yes.
And I tell that it's not like a general biology class. It's not a math class. You know, it is a little different. You know, I can't say that my class is the same as a math class or it's the same as a psychology class. It's a little bit different. And so we touch on topics that are a little bit touchy. And again, being in a safe place is very important, especially in my class. And I have a lot of students that like to draw, very artsy, which is very good. I have students who draw on the board because I can't draw for my life. I wish I was more of an artistic person. And actually in human physiology, being artistic comes in handy because having that art skill and taking a course like mine, you actually learn a little bit more easier because I have students who are very artsy and they can draw and they can make that connection. And so when they're drawing, let's say the heart, they can actually put in all the concepts that I have said or spoken about, and they build around it. And so I tell my students, I was like, maybe you need to start tutoring me because my heart does not look like a heart. But having that connection for them is very important. And a lot of my art, and I have quite a bit of students who are in the art world. And they say, for me to understand these concepts, I gotta draw it. And I'm like, all for you. If you can draw the heart, you can draw the chambers. And if it helps you remember and it helps you make that connection. I think I had a professor who I used to work with who incorporate dancing and the muscles and learning the muscles. And I was so intrigued. I think she was doing a ballet class. And I don't know if she was the instructor of I can't remember, but she incorporated ballet and learning. She was teaching them ballet and learning about their muscles. And I was in awe.
Yes.
It's a world we never thought. So
I love the creativity of that.
Yes. I never thought of it. I genuinely never thought of that aspect. But I think it was arts in biology and arts or something like that. But she intertwined them.
Yes.
It was amazing. So just tells you. So
all humans are creators of some sort. Yes.
And
I love that we have various gifts.
Very true.
So yeah. Well, okay. Well, lastly, do you have any news that you'd like to share with our audience members?
Yes, actually. So I and another professor at Generation Sanjak is starting an allied health club organization. We have our first interest meeting on November 8th at Generation Park from 11:30 to 1. And so the goal of this club is, well, the interest meeting is the first day, and we want to basically get feedback from our students or anyone interested in going into the allied health field or thinking about it and not sure where to go, what to do, how to start, because there's a lot of information out there. And so we just want to gain interest on what students are expecting out of this organization and how we can better support these students, in terms of maybe going to hospitals, volunteer opportunities, what courses are required and they're not sure, what grades are required, what exams are required. So that's going to be our first interest meeting, November 8th. And it's just a good way for students, again, who's interested, who want to just dive in and just see what it's all about and what the allied health world brings. And allied health, when I say allied health, I'm saying across the board: medical technician, rad technician, MRI technicians, nursing, PT, physical therapists, physician assistant, MDs, dental, all of those fall under allied health or medical professions. And generally, they all have to take similar classes. And so our club, we're hoping that our club would get some feedbacks on where we can better support our students. November 8th.
That's exciting.
Yes,
I am glad for you, and I hope that you see several students come and join
we're
and learn.
hoping. We're
Yes,
hoping, crossing
and
our fingers.
engage. It's
Yes,
so important to have time to, I'll say the word practice in our field, our
yes,
chosen field, and to connect with others who have the same
yes.
interest. That's so important.
Very important.
I, I remember one of the jobs that I obtained was from the supervisor I knew. We used to study together. And so as she rose in her career and I had decided to move over to another side of education, she offered me a job. But that was from connecting
Yes,
beforehand. So
very
I
powerful.
hope that you are going to have students to connect early,
Hmm.
because they never know what might be born out of that. So
Never
that's
know.
brilliant. That's
Good to
brilliant.
have
You,
connections and meet other individuals who may be starting out or who already may be in that whole realm of allied health, and they could be leaders and they could guide, the ones that are starting. Um, and I and another professor who actually has a medical degree can definitely provide more insight into the into that world of allied health, which is good. And it's a growing occupational field. A
yes.
lot of our students are going into it. It is lucrative, and you can branch out. You can start, for example, as a nurse, and then I have students who are nurses, but then they're going to registered nurse, then they're going to pediatric nurse, then they're going to surgical nurses, then they're going into CNA. So it's just, you can branch out from there. So many branches, and it's a good learning opportunity.
It sure does sound like it. So
Yes.
wonderful. Well, it has been great to have this opportunity to speak with you, Dr. Kumar.
Thank
Thank
you.
you for taking the time to share with our young performers. You have given them a fount of knowledge about this. This has been great. This has been great.
Good. I
Well, all
hope.
right.
Thank you
Yes,
so much.
you are welcome. You are welcome. And so I guess it's time to close out now. So
Sounds
to
good.
our viewers, thank you so much for taking the time to view this video with Dr. Archana Kumar of San Jacinto College at Generation Park. Um, and also keep in mind the shout out that she gave about the November 8th interest meeting for the Allied Health Student Organization. It will be awesome for you to be part of that opportunity. Well, again, I'm Dr. Daintee Jones. I serve as Director of Fund Development at the Ensemble Theater. This channel is Everyone's a Storyteller, and it supports the Young Performers program at the Ensemble Theater. And remember, each story is important, and you are entitled to tell your story. Until next time, bye.